Good afternoon, everybody, and welcome to Humber Teaching NHS Foundation Trust annual members meeting and AGM annual general meeting. Apologies, our chair Caroline is having a few technical difficulties at the moment, so we'll introduce Caroline shortly. But I wanted just to get cracking and welcome you all to our fantastic event, and thank you to everybody that has been doing the virtual marketplace earlier on. We've had a really great few hours. Apologies, just dipping in that Caroline, there's a few services that we provide across the organisation. And if you remember, it's a whole range of services, plus all the life spectrums really, from Whitby down into Goole, etc. So it's really, really good that people have had a chance to dip in and out of that. We're going to start this afternoon's proceedings by a little video that staff actually have put together, and that's celebrating our work of the staff during the pandemic and as we continue to be in the pandemic. And what we've also did a bit of a poetry competition, and the successful winner you will see goes through runs through all the video. So we're going to start this, and then hopefully Caroline will have a chance to join us later after the video. So no further ado, I will play the video and we'll touch base with you in about 5 or 6 minutes. So good afternoon and welcome everybody, and enjoy the video. Well, thank you. Wasn't that a great video? What a really poignant poem that actually takes us through the pandemic. And thank you to Tracy for that. So if we carry on and we go into the next section, which is my review of the year. So good afternoon, I'm Michelle Moran, I'm the Chief Executive, as I said, of Humber. I just want to just go through a little bit of the review of the year, just picking up some things that you'll find in our annual report that is printed. We've got a few printed copies, but we've also made available on our website. So if we start, and good afternoon and welcome to Helen, who's going to be operating my slides for me this afternoon. So if we go on to the first slide, Helen, that would be great, thank you. So who are we? We're a successful, reliable, multi-speciality health and social care provider. And as I said, covering a large geographical patch. And we improve physical, mental, social health and the well-being of our patients, but also our communities. And the communities and our service users are at the very heart of what we do. And our key objective is to deliver great care and to improve both the physical as well as the mental health and social health of, I say, our patients, the community, and enhance outcomes. Because it's, for me, I'm a clinician by background, I'm a nurse, it's about really improving the outcomes for our patients and our communities and the experiences. And obviously during a pandemic, and we remember that the AGM celebrates it up until the 31st of March, it has been a really difficult, tough year because we're in the real height of the pandemic, but we are committed to supporting, developing and caring for our staff. So if we pop onto the next slide, please. So this is our trust board. We've had a couple of changes this year. You'll see the executive directors, as myself as chief exec. We've got Lynn, our chief operating officer and deputy chief exec. We've got Hilary, director of nursing, allied health professionals and social care professionals. Dr. John Byrne, our medical director. Peter Beckwith, who you'll hear from later, is our Director of Finance, and Steve McGowan, our Director of Workforce and Organisational Development. So we're quite a small team, but we've worked really collectively together across what has been a very challenging year, supporting our patients, our community and our staff. And we've been really well supported by our non-exec colleagues and our non-exec directors that come from a wealth of backgrounds and bring a wealth of different skills to the organisation. We welcome Caroline, who is our new chair, who recently took office from Sharon Mays, who was with us till last week. Sharon's term of office had been completed, and Caroline joins us with a wealth of background, and we look forward to working with Caroline over the coming years. We've got Mike Smith, who has taken a real lead in mental health legislation. Francis Patton, who has taken a lead in finance, but also things around just looking at not our commercial activities such, but our developments and how we're continuing to improve our services. Peter Barron, who's chair of our audit committee. Dean Rose has got a wealth of knowledge in workforce and organisational development, who's supporting us with that, amongst others. And welcome to our associate non-exec director, Hanif Malik, who we really look forward to working with across all the different areas of our services. So if we go on to the next slide, please. So our mission is to be a multi-speciality health and social care provider, and we're committed to our key values, which are caring, learning and growing. And why we are committed to be a multi-speciality provider, that comes back to our core, which is putting patients at the centre of what we do, wrapping care around individuals rather than it being in various different places, so integrated care. We do, and we are aspiring to be a leading provider of integrated care services, but also recognised for the care, compassion and commitment to our staff, who are fabulous. They're absolutely unbelievable. And we want to and are valued as a great employer and a valued partner. And as I say, our key objectives and our key values focus on caring, learning and growing together. We're a team, we're a community here at Humber. We've got some strategic goals, as you would expect, that everything links into, improving patient quality, safety, and we're on a constant journey on that. Fostering integration and partnerships, because again, if we're serious about integrating care around communities, we need to work collectively together with others in the health service and wider. Developing an effective and empowered workforce, because we all know that workforce is fundamental to really great care. Promoting people, values and social communities, that links into all the social values work that we do, all the work that we do in relationship to communities, not just health and physical health related. Enhancing prevention, wellbeing and recovery. We're a recover organisation, which means that we want people to recover, get the best in life, the best life chances, but also that preventative piece. And again, maximising efficient and sustainable workforce. The NHS has massive workforce pressures, as you may be aware, and we want to do all we can to make our workforce as sustainable and support our workforce and to maximise our workforce as much as we can do. Next slide, please. So COVID, I've mentioned a couple of times, we really started off on the front foot. We really got out the starting blocks really quickly as an organisation, and I thank everybody that was involved with that. Infection prevention and control team is a very small team actually in the organisation, but have done a fantastic job supporting everybody within it. We were really positive in relationship to personal protective equipment. We didn't have a supply issue, so we had the advice available, we had the stores, the provision available, and we monitored it exceptionally well. We did a massive, and continue to do actually, a back to basics programme, which is just continuing to reiterate the importance of that 2 metre spacing, face masks, hand washing, vaccinations, the whole piece that goes with not just a pandemic, but keeping ourselves safe. We developed patient care advice and protocols, including visiting guidance, because we didn't want blanket approach to things. We want things to be as individual as they can be and centred around the needs of our patients, but within what were national guidelines, but also within restrictions as well. And we had and developed a COVID ward. We were a pilot site for lateral flow testing for asymptomatic staff. These are staff that don't have symptoms, but we were a pilot site for testing staff. And we've done thousands and thousands of lateral flow tests over the last few months. I think there's over 70,000 recorded. We had a fantastic vaccination centre. We vaccinated the majority of our staff in 2 weeks, which is 14 days, which is a massive feat. And I thank everybody in relationship to that. But also we vaccinated the wider population as well, so other healthcare staff, and we became a vaccination centre or hub and worked really closely with the GPs. So I think there's about 25,000 people in total, and the numbers growing all the time. And we converted our lecture theatre into, you'll see some of the pictures later, into a fantastic vaccination centre. And we've got about 90% of our staff fully vaccinated, and we're still counting, we're still continuing to do. And we've got hundreds more vaccines being delivered and to supporting our partners. So lots of work on the vaccines, and obviously we're preparing ourselves for the next stage, the booster programme. If we'll go on to the next slide, please. What we have done, we'll continue to do all the way through is support our staff. Our staff are our greatest asset, and we cannot get through any of this or any of the work that we've contained in our annual report without thanking and supporting our staff. So their health and well-being is paramount. So we've done and will continue to do a lot in relationship to that. Shiny Minds app, and that is an app that goes on people's phone or tablet, and we can access loads of different things to support emotional as well as some physical health as well. Wobble rooms, which are somewhere that staff can go and just let off a little bit of steam, but it's a safe space for staff, which is very important. Lots and lots, again, we've got a fairly small, well, very small actually, occupational health department, and they've done loads in relationship to psychological support, those staff witnessing critical incidents, a whole heap of things around musculoskeletal services. We've got a recovery programme. We're part of the Resilience Hub that across Humber, Coast and Vale, and we have throughout the years, and continue to do that, a little reward every month just to say how fantastic our staff are, really supported by our volunteers that have delivered the Easter eggs, the hampers, etc. And we're continuing to do a blended approach to working, which is some home-based working, some clinical basing, some basing in the office. Again, it's about working within the guidelines, but working what is maximum and benefit to our patients and our staff. Next slide, please. What we didn't do is we didn't stop any services during the initial pandemic or through the lockdown, and we're continuing to do that even though winter is going to be really challenging. We did protect our inpatient services. We did have to reduce a few of our bed capacity because of the guidance, and we continue to work within those restrictions and guidelines, but we enhanced access to crisis care, and we know that we had hotspots with crisis care and continue to do that with the helpline, etc. That's why we've continually reviewing it, and I've continually increased the numbers of people that are on the phone, the number of lines, and also working closely with other colleagues such as Mind, because just because of the sheer numbers of volumes of calls, it can be hundreds and hundreds per day. So we're constantly looking at how we continue to enhance our access of our crisis care lines. We did reduce face-to-face assessment, especially in our GPs, because in our GP services there was a real statement that we should not do that. We're just starting to increase that, again in guidelines from the government. But what we have been doing is triaging, which is assessing people in relationship to making sure that we can place people in the right area and maximising the efficiency of the systems. Our digital platforms, our IT platforms, and again I thank our small IT department, information technology, for our digital rollout that happened last year, which was absolutely phenomenal. Really pushed that out very, very quickly. Massive rollout, which enabled us to be effective and efficient throughout the year. I mentioned working from home. Growing demand on services. The services throughout COVID and have been coming into COVID were really continuing to increase, but throughout COVID have continued to do that. I've mentioned our fantastic volunteers. They have been absolutely phenomenal, always have been and will continue to do that, and really support all our frontline staff as well as our corporate staff. We're a team together, an unbelievable team. And as we know, we're still in the real heaviness of COVID, but we will continue all that we can in relationship to keeping our staff, our communities and our patients and their families safe. On to the next slide, please. So I'll continue. We've done a lot of transformation. So even though we're in the midst of a pandemic, we've had some successes. Yes, we've got some challenges as well, but we have done some transformation. The digital transformation I've touched on about how we can utilise our digital capacities most. We've actually refurbished and almost completely rebuilt actually with the hospital. If you go up there now, you would think it was a completely new build, and that's been in the midst of a pandemic. It is a fantastic community hospital, and it will be a fantastic facility for staff. Even though we opened it after the annual report was published, we were doing it all the way through COVID. We merged two practices. We merged Holgate and Chestnuts to form King Street Medical Centre. Again, efficiency, effectiveness and working. We opened Inspire, our children and adolescent unit, just before the pandemic started. So there's been a whole year of consolidating that within the pandemic as well. And we've been transforming our community mental health teams, being a national pilot site for the mental health development of community mental health teams. So we have been continuing to do some innovative work in the backdrop of what has been a horrendously difficult year for everybody. Next slide, please. We've also won some awards as well, which has been great. They're great at any time, but in the middle of the pandemic, they're even more precious. Market We in Practice actually won a General Practice Award for chronic conditions, improving care for patients with chronic heart failure. Yorkshire Healthcare Record, the Computing Technology Products Award, which was the best digital transformation project for third and public sector, and our cardiac rehabilitation got a full certification, which is a huge undertaking. So well done to all those. Next slide, Helen, please. And we'll move on quickly. So our achievements, we've mentioned COVID-19. What was really important for us as a team is our staff survey results. They continue to show improvement year on year, and with significant improvement in all our 10 key areas. And that's really important. It's important for our staff that work with us as a team, but it's also important for recruitment as well. And there's really significant improvements, against 68% of questions. Yes, there's still work to do, but really important about some of those. And it was really good to know that with, so for example, equality and diversity, we're in the top 6 of mental health and community trust, which is great. Safe environment, 10th, and improving and high for staff morale and team working. We've opened our new unit. I mentioned Inspire. I've touched on a little bit about workforce, race and equality. We're doing a lot about disability, race and ethnicity, and we've made a lot of strides in there and won some improvements. Quality priorities, there's lots of things in our quality accounts. Please have a look at how we've continued to develop our services in relationship to quality initiatives and using our QI approach, our quality improvement approach. We've expanded our portfolio for GPs, and we only do that when we really think we can make a difference to the community or it's going to benefit the communities of those particular areas. We've had a fantastic, successful research conference. We look forward to our next in November, and we've done a really massive recruitment campaign because, as I say, workforce challenges are quite apparent in the NHS. And please have a look. We did publish a book actually that staff have done a lot of stories about their time right at the height of the pandemic in the first lockdown, and it's called Together We Can, and that's available through all good bookstores, so please do have a look at that. Next slide, please. We've integrated models of primary care and community. I've mentioned the new national pilot. The 24-hour information helpline, that's been partnered with Mine, and again, that's partly to try and really start to attack some of the issues that we've got in our crisis services in relationship to demand. Physio Direct, so that people can get really great access to physiotherapy quickly. And as I say, we're really working towards delivering outstanding care to everybody that comes into our services, into our area, while supporting and caring for staff. We've got white ribbon accreditation for domestic abuse, which is a great achievement. So again, I thank everybody. And we have had a CQC, what's called the transitional monitoring approach, because they'd sort of ceased to do their big inspections. So they did what was called the transitional monitoring approach, and we remain as good across our services. So that's really positive. If we go on to the next slide, please. So some of our performance targets that we have to deliver are in the annual report, but we've mentioned the staff survey. The care programme approach, which is when we follow up patients when they're discharged from hospital, is a key, and that's following people up within 3 days of discharge. Again, our performance throughout the year was over 95%, which is fantastic. The improving access to psychological therapies improved over the year, and it continues to do that. We've got higher levels of statutory mandated training, and we've got a slowly declining staff turnover, which is really good. So lots of different performance. There are some areas that we need to improve on, as we know, and we'll continue to work through that, mainly around waiting times, waiting lists. We know that we've got waiting pressures, as have a lot of NHS organisations. They've actually started to decline over the last few months, which is really, really positive. But we'll continually work on that, and we do a lot of waiting time monitoring so that we do contact the families and people who are on our waiting list. I've mentioned staff survey, but what is also important is our friends and family test that we do very regularly, and 95.3% of the people found our staff friendly and helpful, which is really great. Next slide, please. Everybody always rates 100%, but the trajectory is up. I mentioned staff, our greatest asset, and we'll continue to work with our staff, governors, community, staff side as well, who are very important, to create an organisation that people can feel proud of. And because we've done that, we've started over the last couple of years, a Proud programme for staff, which is investing in you, value in you. And we do lots of different things in relation to leadership courses mentioned, but they're all there to improve service quality and service user care as well, because the two are really intrinsically linked. So lots of work on improving quality, safety, but also that to support staff as well, and bringing the two together. Next slide, please. So we're also working really closely in partnership, remember the integrated bit with the system. So I help with my colleagues lead the mental health and learning disability and autism programme for Humber, Coast and Vale. We have partnered with partners across very difficult times, and we'll continue to do that. The Resilience Hub is with other organisations. I'm also at the moment leading part of the integrated care system for provider collaboratives, which is part of the new integrated care system work. And as I say, we've mentioned the community mental health teams. So if we go on to the summary, which is the next slide, it's been, there are opportunities and challenges, but we do look to the future. We are going to have to continually work with COVID. We are absolutely concentrating on our waiting list and demand for services. That's our absolute topic, as well as developing our staff and workforce recruitment. So please, there's a link there if you're interested in joining us, please do so, whether it's a bank or whether it's a full-time or part-time employment, we are flexible. So in summary, next slide please, Helen. It has been a really challenging year. We have continued to work towards our strategic goals. We have won some awards throughout the year, which is really important. We are continually improving. That's absolutely vital that we continue to improve, and we work in partnership in order to do that. We continue to support our staff, but most importantly, we continue to put the patient and the community at the very heart of everything that we do. So thank you for your listening. I know I've gone a little bit over time, but I always do. But I'll pass you out now on to our lead governor, who's going to do a governor's perspective. So I welcome Staff Mustafa to the annual members meeting. So good afternoon, Sam.
Good afternoon to you, and good afternoon to everyone. Thank you. Yeah, my presentation, I must say right at the beginning, is not going to be as good or anything like that what Michelle has just presented. Nevertheless, I'll do my best. It is a short presentation which will give you a flavor of and the incentive and the excitement of becoming a member, and then after becoming a member to become a governor, and give all the support to the trust to be more efficient and more effective. Next slide, please, Helen. Yeah, just to give this presentation, I have put 3 or 4 sort of objectives, what I will be talking about for a minute or two. By becoming a member and a governor, I think we are actually helping ourselves and our community to become more effective, to provide the required service and care that the community needs. And then I'll talk a little bit as to what the governors do, and then how do we fulfill our role as a governor, and how we have done over the last 12 months. And then finally, I will say something about what is our focus for the next 12 months. Next slide, please. Yeah, becoming a member, I think is an excellent opportunity to build links between the local community, the staff, the stakeholders, and the trust. It is an opportunity to demonstrate our commitment to the NHS and give something back to the NHS and its activities. Meet the frontline people, be inspired from them, and if possible, inspire them. Give support to the research and development, which is so important. Get involved in recruitment of senior staff whenever is necessary. Help develop new skills and represent the patients and carers' views on key issues. Next slide, please. Thank you. Yeah. The question, what do governors do? Sometimes, we ask ourselves, and maybe some people in the community ask that. We ensure the local views are presented or represented in discussions in the decisions of the board. So that's very important, that the views of the community is at least heard and discussed there. We listen to and inform members of any major issues that the trust is facing or doing something about. Whenever necessary, we get involved with the appointment of the chair and non-executive directors. We approve the appointment of the chief executive whenever it happens, and it happens obviously, not very often. And then we are very much involved in the appraisal of the chair, the senior independent director, and non-executive directors. And it's a very important role again. And then we are also involved in appointing and approving the external auditors, another important role, and receiving and approving the trust annual report and accounts. So we get involved there and then help to recruit new members wherever we can. Next slide, please. Achievements over the last 12 months, a few things I'll mention. We have supported the trust through the period of unprecedented challenge due to COVID, which has already been mentioned several times in the last 15 minutes or so. We have been very much involved in the process of appointing the new chair, which happened recently, and the new chair has joined us, I think, about a week ago. We have taken active part we take active part in various committees that we get involved, which again are so important for the efficient function of the trust, like appointment terms and conditions, quality workforce and finance and audit committees, and engaging with members. We also try to influence wherever to become better and work with patients and carers and provide the service that is required. We support by becoming sort of involved with the volunteers and so on, by befriending them and so on. We advise on providing improved services to users wherever possible. Next slide, please. Now for, this is area for the focus for the next 12 months. We continue to support the development of the creative network of staff, service users, carers, and so on. We ask ourselves, and this is very important, ask ourselves as to how we can improve our services and our efficiency. And see, is there something that we need to do more? Is there something that we need to do less, or we carry on? And then we also, how we can communicate. Excuse me, this has come at the wrong time. Yeah, sorry about that. In anticipation of the integrated care service, which we are all excited about, which is going to come, and we make sure that we are well prepared for that. Thank you. Next slide, please. Now, towards the end, I think I have said appreciation and welcome. I think we have to appreciate the very hard work of all the staff in the trust during this very challenging 15 months or so that we have faced due to pandemic. And also, we would like to say something about Sharon Mays, who had been our chair for the 7 years. She provided a very dedicated service, and we would really like her, sort of give her best wishes for her future. And then I think, as I've already said, that we have got our new chair, Right Honourable Caroline Flint, who only joined last week, and we would like to give her the full support and again wish her success in her future position. Thank you very much. Now I think Peter Beckwith is going to give you the next presentation, and I can assure you of one thing at least, that his presentation is going to be very interesting and very colorful. Thank you.
Thank you, Sam. So how do I follow that? Thank you for the build-up. So good afternoon, everyone. By means of an introduction, my name's Peter Beckwith and I'm the Finance Director here at the Trust. And today is the 5th time I've had the privilege of presenting our accounts. So my God, 5 years, that just seemed like I've blinked and I've missed it. So today I intend to cover just a few things. So I'd like to do a bit of a reflection on the last financial year. We'll put out some key headlines from our accounts and then we'll have a brief look forward at 2021-22 and future years. So can we go to the next slide, please, Helen? And the next one, please. So 2021, I think we can all agree last year's been like no other, and I think in the world of NHS finance, that is also true. So last financial year, the normal contracting arrangements under which we operate between NHS commissioners and providers was suspended, and this meant normal contracts ceased to operate, and this was replaced by what was called the block payment mechanism. So under this block payment mechanism, the year was split into two, and for the first half of the financial year, the first 6 months, we received a block payment, but we were also complemented with the ability to top ourselves up to a break-even position. So what that meant was on a monthly basis as an organisation, as long as our expenditure on COVID or income loss was demonstrable and evidenced, we were able to top up our financial position to break even, as were the rest of the NHS. So therefore, any cost responding to the pandemic was recovered. In the second half of the year, we continued to operate on a block payment mechanism. However, rather than being able to retrospectively top up, the Trust received a fixed amount for any expenditure in response to COVID and any income impacted by the block payment mechanism. And we were expected to operate within that allocation and deliver a break-even position. And then finally, towards the end of the calendar year, we started our vaccination programme. That wasn't perceived when the second half of the year planning took place. And as an organisation, we were able to claim and recover the cost for delivering our vaccination programme. We can go to the next slide, please. So in terms of last financial year, whilst it was like no other, I think it's fair to say that, speaking as your finance director, I think we had a successful financial year. And by that, I'll just put out a few headlines. So we were able to make our financial target for the year, which was to deliver a break-even financial position. In doing so, we actually delivered £2 million worth of efficiency savings during the financial year. Under the payment mechanism, we received just over £9 million of non-recurrent funding, and that was to support our response to the COVID pandemic and recover income not covered by our block payments. We maintain a more than healthy cash balance. Just at the end of the year, we've just shy of £40 million, which for an organisation of our size is incredibly healthy. And running alongside that, as a trust, we have no revenue cash flow loans. So we don't rely on funding to support our day-to-day running of the business. Last year, despite the pandemic, we still managed to deliver an £11 million capital programme. And I'm pleased to be sat in front of you today to say that we received an unqualified audit opinion on our accounts. So, I go at the risk of repeating myself, but all in all, it was a very positive year-end finance position for the Trust. So if we could go on to the next slide, please, Helen. So in the financial year, this is our profit and loss account or statement of comprehensive income. So last financial year, the Trust delivered a very small operational surplus of £27,000, which was against our target of break even. After we allow for the exceptional items that appear in our accounts, so things like impairment, contribution to local government pension scheme, etc., the figure in our accounts becomes a reported £220,000 deficit. But I think it's important to know, and I will say this to the reader of the accounts, those exceptional items are generally non-recurrent in nature and do not count against our financial performance or our control tools as we refer to it. And predominantly they are non-cash related items. So purely from an income and expenditure point of view, as a trust, we were able to deliver what was asked of us, which, from system thinking, we can't do any more than that. So if we can go to the next slide, please, Helen. So as an organisation, I'm often asked, where does the money come from? How are we funded? And as you'd expect, we're an NHS provider of services, so the majority of our income is for NHS clinical services. Just shy of 140 million last year, and the majority of that income comes via clinical commissioning groups. On top of that, we also get clinical income from non-NHS commissioners, and that's predominantly our contracts with the local authority for items such as health visitors, health trainers, and addiction services. And then finally, we also receive some non-clinical income. And that's twofold for me. Partly in relation to education and training, we're a teaching trust, so we receive funding to support our education and training programmes, and also items such as estates where we have a broad portfolio of property and we do sublet some of that space to other NHS providers. So that's a bit of a snapshot of where our funding comes from. If you go to the next slide, please, Helen. So what do we then spend that resource on? Well, Michelle did say earlier, and totally agree with this, staff are our greatest asset. And as you'd expect, staff being our greatest asset, they're also the majority of what our expenditure is incurred on. So last year, 130 million of our income was incurred on staff. And the majority of that, as you'd expect, is clinical staff. There's a few highlights on there: nurses, doctors, allied health professionals. After staff, the next two biggest areas of expenditure for the trust are premises. We cover a huge geographical area and we operate from nearly 80 bases across the Yorkshire and Humber. And we have a capital estate with a value of just short of £80 million. So with that, you attract obviously a significant infrastructure running cost. And our second area of spend, non-pay related, relates to the purchase of healthcare. For the reader of the accounts and the more astute among you, you'll notice that has increased between this year and last financial year, and that's primarily for two reasons. Firstly, as part of our response to the pandemic, we had to buy an additional healthcare capacity from the independent sector. And secondly, the trust are increasingly becoming a lead provider of services. So areas such as psychological therapists, perinatal mental health, community specialist forensic services. We operate under what's known as a lead provider model, where we are contracted to provide services over a greater geography, and we often subcontract that to providers that are not in our natural geography, if that's the right language. So could go on to the next slide, please, Helen. This slide, I can personally say, is really pleasing to put up in front of you all. Last year, despite operating in a pandemic, the trust still managed to deliver just over £2 million of efficiency savings. And I think as an organisation, we should be really proud of that. We know that the majority of other NHS organisations stood down their efficiency programme. We kept a focus on it, an appropriate focus, and we managed to deliver £2 million of savings, all of which as well were recurrent in nature. And that just helps us get ourselves on a sustainable footing over the medium to longer term. We can go on to the next slide, please, Helen. So we mentioned earlier that capital expenditure for the year was just above £11 million. Just under half of this was expenditure on building and maintenance work, and that includes our rolling programme of maintenance works to eradicate clinical risk, and also we were successful in securing additional capacity to address what's known as critical infrastructure maintenance backlog. As a trust, we are also the host for the Yorkshire Humber Care Record, and last year we were successful again in accessing national funding to develop that product further. And we were also successful in securing external capital to develop our estate further, and two schemes, some of which are shown pictures on your screen, are Michelle mentioned earlier, we were able to amalgamate our primary care premises in Cottingham, so the new King Street Cottingham Clinic looks fantastic. And we were also to secure national slippage on the mental health programme to actually extend capacity at Maester Lodge and provide increased capacity for other people's mental health beds, which will only help the demands in that area. So could go on to the next slide, please. So cash is always a good indicator of financial health for any organisation. And in the year, we maintained our cash position. If anything, we improved it. There are some timing differences in there, but predominantly we've maintained a strong underlying cash position. And I think that's a really fantastic result, and it's testament to the hard work from everybody across the trust. So go on to the next slide, please, Helen. So just a couple of other financial metrics. So our annual accounts were signed off on a going concern basis. What that means is the auditors have assessed the health of the organisation and feel we're healthy enough to continue operating for the foreseeable future. So there's no risk in our financial statements of not being able to continue to provide services. Again, I've said it before, but I will say it again, we received an unqualified audit opinion with no material misstatements and an agreement that our accounts represent a true and fair view of the trust's finances. And for the last financial year, the use of resource ratings, which are generally used to assess the financial strength of NHS organisations, was suspended. primarily in response to the COVID pandemic. We were operating under normal contracting regimes, and we know the NHS spent a significant amount on agency staff in response to the pandemic. So that indicator was stood down. Historically, we've usually delivered at 2, which is the second best it can be for financial strength. So you'll be glad to know there's just a couple more slides from me. So looking forward. The next slide, please, Helen. So obviously in 21-22, the NHS will continue to operate under a block funding mechanism. And unusually, the financial planning period for the NHS has been split into 2 halves. So for the first half of the financial year, as a trust, we have an approved operational and financial plan. And for any of you that read our board papers, you'll be aware that we remain on plan at the last report to our public board meeting. We are still awaiting guidance for the second half of the year, but we do feel, we have been told the block funding arrangements will continue, but we are expecting some level of efficiency ask in the second half of the year. If we go on to the next slide, please, Helen, which this is the last one for me, be pleased to know. So again, looking forward, a few of us have mentioned it on the call, but we have opened Whitby Hospital. It was an NHS property services led scheme, but the trust are the lead tenant in that property, and we're heavily involved in its development. And I would encourage anybody who's up in the North Yorkshire way to visit it. It's fantastic. It looks brilliant, and that's coming from an accountant. We are very near completion of the strategic outline business case for the re-provision of our adult mental health inpatient beds. Again, that will be a huge achievement for the organisation, and what it will do is put us in the best possible place to be able to access capital funding should it become available, because we've got a scheme on the shelf ready to go. Michelle mentioned on her slides, we have been selected to be the lead provider for specialist mental health services across Humber, Coast and Vale. That will see us being the lead provider responsible for circa 50 million of specialist mental health services, and that should go live from the 1st of October, subject to board approval. And as a trust, again, I'm repeating what's been said earlier, we will continue to be an active leader across the integrated care system as it forms under the new legislation. So I was going to say next slide, Helen, but I think that's me completed, and I think we now go on to a video about We Are Humber.
This is our trust. From Willoughby and Whitby.
I think the new development is going to be very beneficial, not just to the staff, but to the community as well.
To Scarborough and Malton, Bridlington and Goole, we are one community.
One of the first things that struck me about the staff here was their compassion and commitment to high quality patient care.
From the dedicated staff working tirelessly to provide vital services.
Staff are our greatest asset and we need to look after them.
To our patients and service users.
Putting the patients and their families at the very heart of their care.
We are constantly looking to the future because we look to provide the best care, both for the public and our staff.
We recently looked at our environment and decided it was time for a change.
Refurbishment of Granville Court Gardens in Hornsey.
Humber gave us the actual tools and impetus to turn the practice around.
From world-leading research projects to caring for the most vulnerable amongst us.
It's about asking a question, how are you?
It's not just improve, but then be the best.
We strive through the challenging times and the good, and we succeed because we are a community.
It's delightful. It gives me a buzz.
So proud of our achievements to date and really looking forward to the future. I think the charity can only go from strength to strength.
We are one trust. We are the Humber Teaching NHS Foundation Trust.
Thank you. Thank you, Sam. Your presentation was wonderful as always, and thank you, Pete, for the presentation of the accounts, which is never quite an easy thing to do, are they? So thank you for those. You probably gathered, because you've actually still got myself, Michelle. Our chair is still having some technical difficulties that we've been working behind the scenes to try and sort out. So I know that Caroline would say that she's really looking forward to working with everybody in the organisation. And continuing on our journey, and we'll continue to work together on that. And I was just wondering, there hasn't been any questions that have come through, so I just wondered, just looking at the administrators, if anything had come through the chat box or anything that people want to ask us a question. We've got a couple of minutes. I know that we run over a little bit, but we did start a little bit later, so we've got a time for a couple of questions if there are any. I'm just sort of asking our team if there's anything that's come through. There hasn't been any. I'll give people a couple of thoughts. If there's anything that you've heard in the presentations this afternoon that people want to have a bit more information of. There is a question and answer feature in the chat box, so please do utilise that. You can ask us anything, obviously within reason. You know, and we'll give another couple of people another couple of seconds, and then I will close the annual members meeting down. But while we're waiting, I just want to say thank you to everybody that's listened in this afternoon, participated in the virtual market stalls that we did before, just showing a little bit about our services, and again they'll be available for people to dip in and out of, as will this recording. I know I did say this was just up until the end of March, but it is really topical that a couple of nights ago our patient safety team for Children and Young People won a Health Service Journal Award for patient safety. So I am going to take this opportunity just to say thank you very much for that, and well done on that. But thank you all, thank you to our staff, thank you to our patients, our service users, our volunteers, everybody that makes this organisation, the community that what it is. We'll continue on our journey together. We'll continue to working towards great services, carrying on the great services that we've already provided, and developing our services with everybody co-producing that as well. So thank you to the governors, Sam, everybody, for making it a difficult, challenging year, and we are continuing to expect it to be a challenging few months going forward, but I know that together we will overcome all the challenges and the obstacles that stand in our way. And I welcome Caroline. I'm sure lots of you will meet Caroline over the next few months. She's literally only been with us a few days, so I look forward to working with Caroline and everybody else in the organisation, and thank you so much. I have really had a challenging year, but been really well supported by everybody, and thank you all, and please stay safe out there.